This is the positioning of a patient using the 20 steps for an AP lower cervical. Okay, patient's in a gown and stocking feet. All artifacts are removed. Ma'am, we're going to need you to come on over here and have a seat. I'm going to hold the chair while she sits. We're going to make sure the chair is locked before she sits down. Scoot your hips all the way in the back of the seat, sitting up good, straight, and tall. Make sure the shoulders over the hip, palms in the lap, feet on the pegs, and her looking straight ahead. Okay. Artifacts. Marker goes in the lower corner of your 10 by 12 field. 10 by 12 cassette will be locked in. The 10 by 12 position inside the bucky. Artifacts, marker, cassette. We're going to measure our patient, and using the caliper, we're going to measure from the back of the patient's neck at mid-neck, C4, to the front, really gently, at C4. And she's between 9 and 10 centimeters, so when we're between centimeters, we set it for the higher of the two. So I'm going to set her exposure for 10 centimeters. And if there is no chart for a given specialty image, the focal film distance of that image determines which chart you use. So for this image, the A to P open mouth is the go-to chart for the most of our specialty images. So we're going to use the APOM chart and locate the 10 centimeter measurement. And we're going to set our KV at 66. The chart calls for 150. On the MA, skip the time. We'll check that last. MAS, it's asking for 5.25. And it's asking for a 0.035 on the chart, and we have a 0.035 on our time window. So exposures are right. Artifacts, marker, cassette, measure, set exposures. No normal head carriage for our specialty images. Just make sure the patient's face is pointing in the direction that's required for the image. Next, bucky to patient. For this image, we're going to have no head-shoulder angle, so the bucky needs to be 90 degrees perpendicular to the floor, and it is, so the white needle should hang on 90. We're going to rough in the height of the bucky so that the 10 by 12 field is right around the back of her head and neck area. And I'm going to let her know I'm going to gently back her up towards the bucky, and I want her to tell me when her shoulders or her upper back touch. Touching. So at this point, don't expect the patient's occiput to touch the bucky. For most patients, it won't, and that's okay. So bucky to patient, patient to bucky, tube to bucky and patient. We're going to bring our tube in to a 40 FFD. So the arrow on the tube matches the 40 FFD position on the tube track. We need to set our tube angle at 15 degrees cephalad. So the white needle hangs on 15 on the gauge. I'm going to open up collimation. And I'm going to raise the tube until the horizontal beam passes through C4. Okay, C4, mid-neck. Okay. If we need to, we could fine-tune our bucky up or down a little bit so that that horizontal pinstripe of the bucky superimposes the horizontal crosshair of the tube. So I'm going to just drop this bucky just a tiny little bit, superimpose my beam. All right, so bucky to patient, patient to bucky, tube to bucky and patient. I'm going to check her and make sure that she is centered to the vertical crosshair right through the center of her neck. This is the mid-sagittal plane of her neck. I'm also going to check for any head rotation and tilt I see in the setup. If I see any, I would take out rotation by turning the chair. I would take out tilt by leaning her at the waist, but her posture looks good. So we're going to leave her in this position. We don't head clamp the patient for any specialty images. However, I need to, for this image, have her raise her chin until the body of the mandible is parallel with the floor. Okay? It's important that you keep her chin elevated for this image. Usually when you raise the patient's chin, the occiput will get closer to the bucky, and sometimes it will touch the bucky. So if it does touch, that's fine. If it doesn't touch, that's okay as well, as long as the patient holds still with the chin up. We should be fine. Now, there's a little clearance between her occiput and the bucky, and I'm not worried about that. So I'm going to step over and I'm going to get my collimation, 1/2 inch medial to the pinstripe for the 10 by 12 cassette field. So top and bottom shutters first, now my side shutters, 1/2 inch medial to my 10 by 12 pinstripe. And I'm going to check my patient's posturing. We're going to give instructions to the patient to take a deep breath, let it all the way out, watch the patient, let it out, hold it out, keep the chin up, don't move, breathe. Make the exposure, come out and relax your patient. Okay? We're going to change our cassette. New cassette will go in. I'm going to move this tube back out of the way. Okay, I'm going to bring you forward a little bit on the bucky. We're going to reposition the anatomical marker, or at least make sure it hasn't fallen off the bucky. We reset our exposure factors for the next image. And we're going to return to step 6, which is reestablish normal head carriage. Again, for her standard images, she would be marked at the chin and the episternal notch, and we would just bring her back in alignment with her normal head carriage posture in preparation for taking her next image.